By Sarah Stewart-Brown, who's a Professor of Public Health at Warick University. Professor Brown, thank you for joining us. It is very much the only thing that people seem to be talking about, and given the restrictions that were announced yesterday, many are questioning if they go far enough. Do you think they do?
Yes, I'm sure they are going far enough, and I think the main problem at the moment is people's panic and fear. We are all going to come in contact with this virus over the next few months, and the question is only when, it's not if. And it isn't a particularly dangerous infection. What's different about this from any normal flu outbreak is that nobody has immunity, so more of us are going to get our minor infections at the same time, and that's going to have a knock-on effect on businesses and on hospitals and all the rest of it. But the virus itself isn't particularly dangerous, and the main thing that we can do is do whatever we can to support our individual immune systems, so that if when we come in contact with the virus, we either don't get any symptoms at all, we just develop immunity, or we get symptoms which are short-lived. And the thing that depresses your immune system is fear and anxiety and panic. So we're actually creating a situation at the moment in which we will make whatever happens with this outbreak worse.
Professor, I understand the point that, fear and panic isn't necessarily going to help, but you can understand why people are concerned. Let's just take you through some of the questions and worries that people have. One of them is the panic buying. Like you said, the panic manifests itself in different ways. Clearing the shelves of things that other people might need is one of them. I'm sure you would join us in urging against that.
Yes, I'm still not quite sure what people were doing with their loo paper. And certainly it's not necessary to do this. I mean, people who get sick are being asked to stay at home and to self-isolate, but there are phones and there are ways of getting in touch with other people, and certainly if you are trying to self-isolate, the other effect we know on the immune system is that social support enhances it, and being isolated and being shunned makes it worse. So people can, when they're self-isolating, stay on social media, stay in touch with other people. And if you run out of loo paper, somebody will bring you some. It's I think we've got the level of fear quite disproportionate to the issue, and the level of fear is making it worse. So anybody who's got any skills in regulating their nervous system, anybody who started doing, goes to yoga classes or goes to Tai Chi or goes to community singing, any of those things, we just need to do more of them now. We need to do anything that we know can calm us down. It might be going for a walk with a dog, or it might be something else that you know helps you calm down. Yes. But just do more of that.
Okay, just a final question to you, Professor Brown, and it's the concern about older people. And I know one of our views that we had was about not liking the term elderly, and I think Boris Johnson did say that we may well lose our loved ones before a time. Now, that kind of language is very scary, isn't it, for all of us? So how do we reassure people and indeed protect them?
And I don't know why he said that in that way. Yes, people who are sick and elderly and coming towards the end of their lives anyway, if they catch this virus in the same way as if they catch flu in the winter, it may be what takes them off. But it's not. It's no different from getting the flu, and we can take sensible precautions to stop that happening. And it may be that some people die slightly sooner than they would otherwise do. But what we're creating at the moment is a situation in which that's more likely to happen, not less. So I think it really calming the situation down, suggesting that we keep children away from schools to stop them getting it. Well, this is a very mild infection, it seems, in children, and for them to develop immunity is really important. So we know we need children to get chickenpox when they're young because it's actually a better time to get it. Well, the hype what was going on about, I think it's very unlikely they will close schools shortly because it's not a sensible thing to do. And for people to keep their children away from school really isn't good.
My apologies, we're going to have to end it there because sadly we're running out of time. I know we could spend the entire programme on this and we may well do that in the future, but for now we have to leave it there. Thank you very much for joining us.